Welcome to Podcast UK.
Have you ever wondered how bone heals? While we may not be orthopaedic surgeons, plastic surgeons do need to understand the key principles, and understanding what happens to the patient you've seen with a hand fracture that helps them to get back to a healed functional state, well, that's got to be worth understanding. Before we get into the specific mechanisms involved, it's important to remember a few relevant things about bone. When we think about bones, we tend to think about skeletons like we may have encountered in anatomy teaching, avascular and static. But living bone is nothing like this. It's in a constant state of dynamic remodeling as older bone is replaced by new bone according to the forces it experiences, while it also has a rich blood supply derived from the periosteum, the epiphyses, and nutrient arteries. And both of these factors are very important to its ability to heal. So broadly speaking, we can classify bony healing into two key mechanisms, primary and secondary. Primary bone healing is characterized by many of the same mechanisms that are key to bone remodeling. It relies on good reduction to ensure good bony contact and rigid fixation to ensure absolute stability. Because of this, cutting cones can directly cross the fracture site. These are cone-shaped structures with osteoclasts at the tip to break down bone, with capillaries behind, and then osteoblasts which follow and lay down new osteons, directly producing lamellar bone, resulting in direct cortical repair, as these cutting cones can directly cross the fracture site. Very small gaps, under 500 microns or so, can directly form woven bone, which is then replaced with lamellar bone. So this is the type of healing that you're aiming to achieve when you fix a metacarpal fracture with a compression plate, for example. The bone is reduced anatomically and held in absolute stability by your plate, and this allows for primary healing. Secondary healing, by contrast, is what occurs where there is insufficient bony contact and relative stability, and is characterized by the presence of an intermediate cartilage phase. So this is the type of healing you see with a fracture managed non-operatively with a cast, or operatively with non-rigid techniques like K-wire fixation. This consists of 5 main stages: hematoma formation, inflammation, soft callus formation, hard callus formation, and then bony remodeling. Firstly, around the broken bone ends you get hematoma forming. Within this starts the inflammatory phase, as cytokines including interleukin-1, interleukin-6, and TNF-alpha are released, resulting in infiltration of neutrophils and macrophages, followed by fibroblasts. Soft callus then begins to form. This is fibrocartilage laid down by chondrocytes from the periosteum, and further provides some additional mechanical stability. This continues to mature over the first few weeks. Blood supply also increases as periosteal angiogenesis occurs. After 3 weeks, this transforms into hard callus, with endochondral ossification, and woven bone, where the collagen is orientated randomly, is laid down by osteoblasts to replace the cartilage framework. This process takes several weeks to fully finish. There is then an ongoing process of bony remodeling, which takes place over the subsequent months and years, as woven bone, with the randomly orientated collagen, is gradually replaced by lamellar bone, with collagen fibers in parallel layers. Osteoclasts at the front of cutting cones remove the woven bone before it is replaced by following osteoblasts. As this happens, the bone remodels along lines of stress in response to the mechanical forces applied to it, and you may remember this is Wolff's Law. A number of factors can all influence bone healing. Poor blood supply, such as in scaphoid fractures due to their retrograde blood supply, is an important cause of non-union, while blood supply can also be affected by diabetes and smoking. Smoking also directly impedes osteoclastic activity. Infection, malnutrition, and medications, including non-steroidal anti-inflammatories and steroids, can all negatively impact bone healing. Mechanical factors also play a role. If there is inadequate stability and excessive movement, even secondary bone healing may struggle. So that's the basics of how bone heals. There are some extra elements where we come to consider how bone graft heals, but I think we should cover this in another episode. I hope that was helpful. Goodbye. Podplast UK is a collaboration between UK and Irish plastic surgery trainees and consultants. The content reflects individuals' practice and opinions may vary. If you have any feedback, do get in touch. We hope that this has been interesting and useful. If it has, remember to follow us for future sessions.